Well, the worst of the pandemic may be over, but its effects are still being studied. Long COVID is a collection of symptoms that doctors are seeing across the world months after patients get over the virus. Now there is some new data from the University of Missouri, and it's shedding light on how workers are feeling as they return to the office if they're dealing with some of those lingering symptoms. Dr. Mario Castro is with us this morning. He's the vice chair for clinical and translational research at Kansas University Medical Center. Doctor, thank you for being with us this morning. What more do we know now, years into the pandemic, about long COVID that we didn't know early on in the virus?
Well, we know that certainly it represents a substantial proportion of the population, up to 2% in a recent study from the UK, of the population have been affected with long COVID symptoms. And we now also know from this recent study you referenced from the University of Missouri that results in significant disability, much higher rates of disability we're seeing in the workplace.
So it is recognized in the medical community as a disability. Is it being recognized in the workplace as such, that people are being excused and it's understood that this is an illness that is long-lasting?
Definitely. I think we have seen it here locally as well as in my colleagues around the country, where we're seeing more and more cases of long COVID that are resulting in disability, both in the workplace and not really allowing some of our patients to return back to work.
So what are the symptoms that prevent someone from working and focusing on their job?
Well, one of the most common symptoms of anybody, your listeners have had COVID, is just that profound fatigue. And as you can imagine, if that profound fatigue persists over time, and that's what happens with long COVID, it persists beyond the usual 2 to 4 weeks it takes to recover from COVID, then it starts to result in weakness and disability, and it results in your muscles actually just becoming weakened. And so, one of our main treatments we have right now is to really focus on that rehabilitation.
Do we know why some people have the lingering symptoms of COVID, long COVID, and some people don't? What's happening inside the body with the virus?
Well, there are a number of different new theories about what exactly causes long COVID, but we do believe that this, in essence, this over exuberant immune system that we have against this virus contributes to that degenerative kind of disease that occurs in the muscles and the nerves in our patients. And we know that really the best thing that we have right now for treatment is really to help patients recover from that, as we've treated other patients with muscle weakness and injury to the muscles and nerves.
And what are some of the types of treatments you're seeing? I know that there have been long COVID clinics that have opened up, and in some areas there are long lines to try to get into them. What are some of the things they're doing to help people combat the multitude of symptoms that we're seeing?
Well, our approach here and an approach in many places is first to do a kind of a systematic review of what's happening with that patient and their symptoms. And then the approach then is to really guide them to the specialist that will help them the most with those symptoms. So if you're having brain fog, what we call cognitive impairment, it really is focusing on how do you recover from that. If you're having shortness of breath, coming to see somebody like myself who's a pulmonologist to really focus on exactly how did COVID impact your lungs and how can we help you best recover from that.
And typically, how long are we seeing these symptoms last? Months, years?
Well, as we go out further from the pandemic, we're learning more and more. But currently, we know that the majority of these patients with long COVID will resolve their symptoms within a year. So that's some good news, some recent data from a study done in Israel. But we also know that there are patients that are persisting with symptoms even years out from the original infection.
Yeah, still so much to learn, but good to know that folks who are dealing with it are finding some support. Dr. Mario Castro, Vice Chair for Clinical and Translational Research at Kansas University Medical Center. Appreciate your time this morning.
Thank you, Marni.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.